translator here with us. I've just been advised that the nearest Auslan translator is actually in isolation. So I guess that's indicative of things to come, sadly. Look, there's a few things that have to be addressed today, and I think I'll start with what we would expect to be done, which is the basics. Today we can confirm that the last 24-hour period from 8 p.m. last night to the previous 8 p.m. The previous night was the numbers are now up to 436, I think. Yeah. So I'll do it again. The numbers have increased in the last 24-hour period by 83. The previous day it was 75, and prior to that it was in the 40s and 30s. So it is increasing. And I'll ask, I'll just go through this with other issues. Last night I signed an order which required that all gatherings now have 4 square metres around each person. So that'll be worked through by the various facilities over the next few days, but it implements tomorrow, or actually, yeah, tomorrow. We also have an order that was made by me last night for Lord Howe. There'll be no more travelling to and from Lord Howe for tourists as of tomorrow. That obviously is to safeguard the community. Perhaps I'll get Dr. Shepherd just to talk about those issues, particularly the numbers and the breakup of the numbers, and then I'll do some more talking.
Yes, as the Minister said, as of 8 o'clock last night, we're at 436 cases of COVID-19 confirmed in New South Wales. So each day we are getting increased numbers of confirmed cases, but I do note that the vast majority of those cases are people returning from overseas, particularly the United States and Europe. These people, when we interview them, are well aware of the restrictions and have been isolating themselves, so there has been minimal exposure of the community. The other large group of people that are being notified, making up those numbers, are close contacts of confirmed cases, so household members, and once again these people are already in quarantine, so there are relatively few people being notified that aren't part of those existing transmission chains. The Minister mentioned Lord Howe Island, so as of last night, no non-residents can enter the island unless they're emergency personnel, healthcare workers, and even residents returning are asked to go into quarantine for 14 days to reduce the risk to residents of that island, where there can be limited access to medical care, particularly with bad weather. So this was a measure put in place with the cooperation of the Lord Howe Island people to reduce the risk of COVID-19 being introduced to Lord Howe Island. What other issues?
And also, sorry, thanks Vicky. I'd also like to address some other issues, and as I said, in the last 24 hours I've had to make as Health Minister in New South Wales 2 further orders. One is to obviously stop, at the request of the residents of Lord Howe, I've had to stop the continuation of tourists entering into Lord Howe. That's a difficult issue because it's a small community, and at their request I have delivered that order. Our government is obviously very keen to respond to communities who are in particular need, and an island off the coast of New South Wales is a particular need. I would ask the tourists who might have been otherwise flying to Lord Howe to understand that the world has changed, Australia is changing, and to definitely contact the airline, your travel agent, and if they don't know about the order, make sure they're aware of it, and I'm sure, I hope, that Qantas and the travel agents will look after you. But in so doing, know that you are also, by not going, looking after the community of Lord Howe and safeguarding the community there forever. Can I say, in regard to the broader issue of the community's activities with regard to social distancing, I said yesterday I was bitterly disappointed when I was told that there were large groups on Thursday night down at Bondi. I have heard in other areas as well, but particularly that mecca for so many foreign tourists, but also Australians to go to. And as a result, today, it appears that there's been no real heeding of that message. And the government has taken the steps necessary to make sure that people understand that social distancing is for you and for your family and for your friends. It's not just about you. Now, I know that there have been reports of a great number of young people there, and I suspect, having spoken to quite a number of young people, that they feel that this isn't going to hurt me, so why worry? Well, the answer there is it can hurt you, but it also can hurt your family and your friends, so take it seriously. Have a little look overseas and see what's happened in other countries. Very short memories. China, Iran, Italy. It is very, very bad overseas, and if it were not for the work that's been done by the federal government and all of the governments here in this country to date, we would have such a problem. But the problem is just over the horizon on the basis of the numbers that we're now seeing, particularly here in New South Wales, where they are actually showing a substantial increase. We'd all remember the numbers just in the last few days. They've effectively almost doubled just in the last week on a daily basis. So it's a serious matter. Save yourself and save your family. Listen to the messages that are coming out, not just from government officials, but from the doctors who are leading our advice to you. I fear that some people just do think they have that optimism bias, that it isn't going to affect me. Well, yes, it could well do. And it's a very, very important message to each and every member of our community. And I'll just point out that at the moment, out of the numbers that we have, there are quite a number. There are 72 in New South Wales who are in the age bracket from 20 to 29. And in the age bracket of 30 to 39, there's 103. And in the age bracket of 40 to 49, there's 82. It's serious. It's across all age groups. It may be that you'll be less likely to die because, yes, sadly, the older age groups are very much exposed to that risk, particularly if they have comorbidities, in other words, other health issues. But do the right thing. It's time to actually do what Australians always do in times of trouble. Do the right thing by your mates. Do the right thing by the rest of Australia. Do the right thing by your fellow family and residents. The 4 square metre order that I made last night, this will affect every club, every restaurant, every indoor facility. It has been made on the basis of medical advice. Our most senior chief health officers from across this country have met and have determined that each individual must have 4 square metres on average inside any facility. So to those proprietors, I ask you as the Health Minister, but just as a fellow citizen, please do it. Please make sure that you comply with this rule. No one wants to see enforcement. What we want to see is compliance. So do it to save your patrons, save your people who come to eat in your restaurants and your clubs and your hotels. Just do it. 4 square metres. In terms of the cruising ships issue, there's been an issue yesterday and today in the publicity, or subject of publicity. It is frustrating because it's an evolving situation and it's moving very, very quickly. And I think it's fair to say that communications at all levels, perhaps between members of the public and members of the community more broadly, aren't hearing the messages. But can I just say this? The federal government made an order that required cruising ships to cease cruising for 30 days. That has seen in the busiest port in Australia a massive inflow of ships. And each of those ships, in fact, since mid-February, we've had 63 cruising liners come through the port of Sydney. The federal government's national direction occurred in mid-March. The state government here in New South Wales has actually already had a very strict compliance regime that dates back to the second week of February. And so New South Wales Health informs me that New South Wales is actually going over and above what the national guidelines are. Now, I know there might have been some contrary comments to that today, and I don't intend to comment on the author, but I do intend to comment on the fact that this is the facts. New South Wales Health has made sure that every one of those 63 ships since the middle of February, long before the federal guidance and directions, has had a full assessment. Now, what that means is, if you've got 4,000 odd people at sea, obviously it's not practical to go through every single person, but the senior public health staff sit down and work with the ship's owners, and they determine what are the number of people on board, where are those people coming from, are they essentially Australian or do they come from overseas ports, particularly do they have any health indicators on board of respiratory disorder, and if they do, if they make an assessment that that particular ship requires further checking, as has happened on a number of occasions, in fact 6, the ship has docked, and then the people who have been highlighted on the sick list from the ship as having had respiratory disorders, those people have then been swabbed and turned around as quickly as possible, and those people either cleared or not cleared. And I remind the community that in fact there were media going back about a month where people were thinking that we were being a little bit over the top when people were held on board the ship until their tests were completed. In fact, with the benefit of hindsight, yet again, the New South Wales government, and I've got to say our Chief Health Officer, Dr Kerry Chant, and her entire team are making very sound decisions, often ahead of the so-called curve. And I'm very happy about that as the New South Wales Health Minister. I'll say nothing else about that at this point. And other than that, I think the final message just... I will say this, that obviously as this situation evolves, we have... obviously, with the numbers we now have, we can expect to have more people in all quarters of our community becoming subject to the COVID-19 virus. There was another incident which occurred in an aged care facility at Engadine, and that facility, I want to thank New South Wales Health staff have assured me that the staff there have worked extremely well with New South Wales Health, and they actually preempted some of the new requirements that are now in place. So, for example, the restrictions on visitors and so on, and they were actually testing their residents proactively if they had any respiratory issues, and that's actually how this one particular resident was identified. So I want to thank that aged care facility at Engadine, and just say to other aged care facilities, we've obviously had our difficulties in Sydney, in one particular one where there was more than one. I think there was about 3, and to all aged care facilities, I'd like you to do what certainly this particular facility has done and many others are now doing, and that is taking this particularly seriously. I don't think there's anything else proactively I have to tell you, but I'm happy to take any questions or comments.
Minister, what happens to those cruise ships now that are floating around Sydney Harbour?
The cruise ships that are currently in Sydney, I was actually advised last night by an individual that a cruise ship had entered the harbour, and so as the Minister, obviously I wanted to check, well, what was the details, and I instigated some discussions with the Senior Federal Minister and also Border Force, just to check on what what assistance could be given if there were any issues. As it turned out, each of the ships that entered yesterday in response, they're all coming in, that's the problem, they're all coming in because of the federal government's direction that there's going to be a shutdown, so they're cutting their cruises short and all coming in. But what we had yesterday, and yesterday evening, was happily ships who had no, I'm not talking about the Ruby Princess, I'm talking about the ones last night and today, who had no travellers on board, they had crew, and the arrangements there are that the crews, if, for example, they come from another country, they stay on board their ship under the national guidelines until they can be transported straight to the airport to connect with their flights to go to their home countries.
So how long could that take? I mean, some of these ships that are floating through the harbour at the moment, passengers that hopped off have been diagnosed with COVID-19. They have been in close contact, so what happens to them
Obviously, the ships, we have one off the Ruby Princess, off the coast at the moment, who has one confirmed case, which I referred to yesterday, and New South Wales Health has been working with the staff on board. I'm advised by New South Wales Health that the company has done all that's appropriate, that is isolated all of the staff within the cabins that were previously occupied by passengers. And if necessary, of course, we would take steps to assist. At this stage, there's been, as I understand it, no indication that that particular crew member requires anything more than isolation. Remembering that 80% of people who get this virus will have it in a very mild form. We've seen some very high-profile people, Tom Hanks, Minister Dutton, who've seemingly been brought, or had it, but not brought down by it. It's a mild case. But some, of course, have it very severely. And as I said earlier, and I've said many times previously, particularly those with what the doctors refer to as comorbidities, but it basically means if you've got any other problems, like lung problems or diabetes or coronary issues, then perhaps you're more exposed. Those people, of course, may get it in a more severe form, and those people, New South Wales Health would work to make sure their crew members, if they actually had it confirmed, were well looked after, as they are doing with all other people in New South Wales.
They're isolated. We're surprised to see that we got some pictures of them this morning from the helicopter. They're all on deck smoking cigarettes, playing darts.
This is the Ruby Princess? Well, again, the isolation requires them to be at distance from each other, and that isolation at sea is certainly not something which is impacting on our community. So, but the message would be...
Human beings, right? Human beings. They're off our coast, so surely the God must have some concern for their welfare.
As Health Minister, I can tell you I have concern for absolutely everybody who is likely or possibly going to get this virus. And that's why there's so much work going on with incredible people like Dr. Vicky Shepherd, Dr. Kerry Chant and all of their frontline health staff. But we also have to recognise that a ship off our coast has a captain, and the captain is making decisions, and he's making decisions based on the advice that's given, not only by New South Wales Health but by Federal Health. And I hope he is actually ensuring that they stay in isolation, keeping in mind though that there's no clarity beyond the one person at this stage, so I would think that he's trying to just keep them as isolated as is reasonable. But in the fresh air, that's at least a positive.
But there's a huge amount of concern in the community that 3,000 people were let off the day before yesterday while tests were pending. Princess Cruises told you there were tests were pending, yet you said, oh well, they're probably still cold. So
no, that's not quite right. And I'll get...
Princess Cruises didn't tell you because they've told us that they told New South Wales Health the tests were pending.
Well, as I understand it, there were 13 respiratory tests done on board the ship, and there was no indication that they might have been COVID. And as I understand it, what happened was that New South Wales Health did extra testing, but let's find out from the expert, because she's also the person directly responsible for the cruise ships coming into the harbour.
Minister, just quickly on...
I'll come back.
You don't come back? Okay.
I'm not going to disappear. Sorry. Can you just answer that one?
Yes, so with the Ruby Princess, we did a risk assessment, as we've done for all ships that come in, and our assessment was that it was a low risk for COVID-19. There was a low rate of respiratory illness on the ship, and people had been tested and some had been found to have flu. But as the Minister said, out of an abundance of caution, we did decide to double check and run those swabs through our lab here at Prince of Wales.
So at no point did they say we've got tests pending for coronavirus?
Oh, sorry. The ship can't do tests for coronavirus. They do tests for flu, and in fact they did find some flu. But because of the increasing rates of coronavirus that we've been seeing, we decided that even though we thought it was a low risk of COVID, that we would bring those swabs here to the lab.
Why would the cruise ship company tell us that that's what they told you?
Sorry, what did you say there?
Why would the cruise ship company tell us that that's what happened? I don't understand that. I'm sorry, I don't think I'm contradicting what you said. Would you mind saying... No, I was just saying, so I don't understand why the cruise ship company would tell us that they told you that they had coronavirus tests pending when they can't test the virus.
That's right. So they gave us the swabs and we brought them here to the lab, so in that way the coronavirus tests were pending.
Okay.
Yep.
And you still decided to let all the passengers off?
That's right, because the initial risk assessment was that it was a very low risk for coronavirus, and out of an abundance of caution, we decided to run those swabs through our lab.
There was enough risk there for you to send it off for a coronavirus test?
Yes.
But you still let passengers off?
Well,
You understand how the community probably thinks, does that make any sense? What's 24 hours matter?
yeah, so we had done this risk assessment, and the expert panel believed it was a low risk, but because the swabs were available, it was decided to test them.
Will that need to change now? I mean, the Ovation of the Seas docked a few days ago. They've got a case. They've got 4,000 passengers that have then gotten off and wandered around. Is this policy wrong?
Well, of course, we're in a different situation now. There's no passengers on these cruise ships. We're now having to look
but
at.
There were passengers, so when they did have passengers on it, we now have to think differently about how we do this. If another ship comes in.
Sorry, I think all the ships with passengers have disembarked. So now we're dealing with ships with crew, and those crew mainly from foreign countries that then need to go to their home ports. So yes, we are looking at a different process now that we've had COVID aboard a number of ships, and we will be developing a new process so that there is increased screening and testing before the crew are let off the ship.